So people, now let us look at this ECG Made Easy book by Atul, Luthra. There are many books like this in the market. We'll show you one more that we have reviewed here. This one also we have seen. Well, this video is mainly about this book, which is by Atul, Luthra. Let's look into this. So here in the contents, what are they telling? Nomenclature, electrocardiogram. ECG stands for electrocardiogram. Then you have the deflections, interval segments, etc. You should know. Then what are the leads, limb leads, chest leads, the orientation, what is Einthoven triangle, all that you should know. Then they are talking about the normal ECG. Then they are talking about the electrical axis. Okay, then there's a left axis deviation, etc. All that you would have heard, isn't it? Then you have the QRS complex. Then how will you determine the heart rate? How will you talk about the rhythm? Then abnormalities of P wave they are saying as a separate chapter. Oh, there are a lot of content here. Abnormalities of the QRS complex, abnormalities of the T wave, U wave, PR segment. Now they're talking about the segments, right? Of the intervals also they're talking about the abnormalities. Okay, people focus here. Then narrow QRS, fast irregular rhythm, wide QRS. Wow, this is not an ending. Okay, wait. Let us look at this. Bizarre QRS. Okay. So, a lot of information is there. How will it be in a pacemaker patient? How will it be in a dead body? You should know, right? Flat ECG. You will get, hopefully you have connected it correctly, right? And then you should be able to tell, look at an ECG and say whether the leads were connected correctly. If it has been connected incorrectly, you should be able to just see the ECG and see, right? You should not make a wrong diagnosis. So look at the book. Some formula here. And this is the normal PR segment they are talking about. The normal ECG segment. So you have a PR segment. You have an ST segment, right? Two segments they have shown here. And rhythm, you know, can be sinus rhythm, which is normal, right? Then you can have atrial rhythm, which is coming from here. Or you can have a junctional rhythm coming from here. Or a ventricular rhythm. So you should know, normal it is sinus rhythm, right? And some other diagram here, zones of myocardial infarction and their ECG effect. So if there is an ischemia, you will see an T wave inversion. If there's an injury, you will see an ST elevation, right? Necrosis, if it is there, you will see abnormal Q wave. Some other things they're talking about, right bundle branch block, M-shaped complex in the V1. So in the V1, you will see an M-shaped complex. To me, it looks more like a W, right? Okay, then slurred S wave in L1, V6. And L1 and V6, you have a slurred S wave. Okay. This is right bundle branch block. Similarly, a lot has been given in this book. So you can look at this for every complex, every segment, abnormalities they have described as separate chapters. So ECG in a pacemaker patient. Let's just go back and look at that. So here you can see that the pacemaker spike is before the P wave. So this is a ECG in a pacemaker patient. And here they are showing you the same spike after P wave. This is ventricular pacing. So you can have different type of pacemakers, right? What ECG do you see here? So basically this is a sinus bradycardia followed by asystole. And this is Sick sinus syndrome looks like bradycardia, sinoatrial exit block, slow atrial fibrillation, junctional escape rhythm. Look at these waves. What do you think? This is progressively increasing hypokalemia. So what should you see here? The T wave. Look at that. The T wave is not marked in the last one. No pot, no T. No potassium, no T wave. See, they have explained here. Reduced amplitude of the T wave, flat T wave with prominent U wave, ST segment sagging, only U wave. Now look at this and tell what you see. The T waves are tall. So this is progressively increasing hyperkalemia. So tall T waves, then you have some other things as the values increase, right? Prolonged PR interval, wide QRS complex. Also this AV block can happen, arrhythmias can happen if the serum level increases much beyond 9. So that's it, guys. They have also given you the causes of hyperkalemia. So look at this book, and as a review, this book looks useful, and like we told you, there are many such books in the market for you to learn ECG. So make your choice, people. Basically learn how to read ECG. Okay, that's all for now. Bye bye.